Hi, my name is Seth Powell, and I am presenting on the research paper Avoidance Behavior Generalizes to Eye Processing in Post-Traumatic Stress Disorder, authored by Selim Yahya Cole, Francis Eustache, Frank Doide, Florence Fries, Dennis Pischansky, Jacques Dayan, Pierre Gagnapan, Michael Leisny, and published by the European Journal of Psychotraumatology. This article studies avoidant behavior as a protective mechanism in trauma survivors who have developed PTSD, in this case specifically pertaining to an inability to maintain eye contact or gaze with people exhibiting sad expressions. Method: to determine whether avoidant symptoms of PTSD presented with greater significance pertaining to gaze, researchers used a monitor and software which observed participants' eye contact with facial expressions displayed on screen. Using cameras, they studied the duration of time that participants spent looking at different facial expressions. Recruitment. The method of recruitment for participants with PTSD was to pull from an adjacent study which recruited from survivors of the 2015 Paris terrorist attacks. The control group in the study were those who were involved with the attacks but were diagnosed negative for PTSD and pooled from residents without PTSD or any involvement with the attacks from a neighboring French region, Normandy. Results. Researchers found that individuals diagnosed with PTSD spent notably less time looking at sad faces compared to neutral or happy faces. And this reduced looking behavior correlates negatively with avoidance symptoms, effectively displaying that the more severe the avoidance symptoms, the less time spent looking at sad faces. Critiques. Major strengths of the article. Source: published by the European Journal of Psychotraumatology, which is peer-reviewed and whose primary contributors are renowned multinational universities. Funding was by the French government with the ambition of rehabilitating French nationals who were negatively impacted by the 2015 Paris terrorist attacks, as opposed to grant funding from self-interested private donors. Their findings matched their hypothesis, and the article was clear in ambition and correlation. Weaknesses of the article. In a study that generalizes to symptoms and behavior of all PTSD victims, why not choose participants who experience PTSD as a result of different types of traumatic events? Aside from gender of participants, 81 male and 78 female, no further information about socioeconomic or racial background was provided. Dated technology. The software and hardware used to study the gaze duration of participants was almost a decade old at the time of the study. More modern technology certainly would have aided in accuracy and subsequent credibility of the results. Conclusion. The value of this study is in identifying symptoms and as a further aid in alleviating negative affect disorder due to repression. Avoidance symptoms developed during trauma is a protective mechanism. The issue is that once a trauma survivor is no longer in any danger, the symptoms persist, which has a lasting adverse effect on the ability to confront painful memories and healthy social development.